Hello, I'm Ron DiMatteo. I'm the current SSO president, and today I'm speaking with Dr. Shishir Maithel, editor-in-chief of the SSO's new open access journal, Surgical Oncology Insight. Thank you for joining me, Shishir.
Oh, thank you very much for having me. Look forward to speaking with you.
So I think everybody wants to learn a bit about this new journal. So what is your overall vision for it?
Oh, thank you for the question. I aim to make this journal a truly global effort, including original research from all over the world. We have assembled an international advisory board, including all the 12 global partners of the SSO with representation from each of them, which will hopefully greatly facilitate this effort. I've also created an invited series of articles which highlight novel surgical techniques employed in various countries around the world, emphasizing the multidisciplinary approach to disease and focusing on the clinical applications of clinical trials conducted within each disease space.
And not everyone may be so familiar yet with open access journals. What do you think the benefits of them are?
Yeah, the single greatest benefit, as I see it, of an open access journal is that your article is made accessible to the global community immediately upon acceptance for publication. There's no delay in your article getting published, and the readership is not limited to people who have a subscription to that particular journal. Another question that's come up a lot of times as we have started to open this journal is about being indexed on PubMed. And it's important to note that we are also actively working to quickly get Surgical Oncology Insight indexed on PubMed as well.
Mhm. So how would somebody actually submit a paper to Surgical Oncology Insight, and what are the projected costs?
Yeah, so anyone can submit to Surgical Oncology Insight by accessing the journal on our website, which is surgoncinsight.org, or you can access the journal through the sciencedirect.com website. The costs for submitting a publication are as follows. For an original research manuscript, it's currently set at $2,300. It's $11.50 for a brief report or a technical advanced paper. It's important to note, however, for the first 50 publications that we have actually waived all publication costs. And so the first 50 publications are free. We also have a very nice arrangement with our publisher, Elsevier, that in 2025, calendar year 2025, there will be a further 50% discount on publication costs. And there will be a 25% discount on publication costs in the calendar year 2026. Furthermore, as an SSO member, you get a further 25% discount on all of those previous discounts that I just mentioned. So on top of those 50 and 25%, you get an extra 25%. And then finally, Elsevier participates in the Research for Life program. So there is a substantial discount or waived fees for agreement for low and middle income countries that participate in the Research for Life program. And many institutions and countries have transformative agreements between their institution or country with open access journals and the publishers. So anyone submitting an article should check on that too to see if the cost could be covered by their institution or country.
The Annals of Surgical Oncology has been such an important journal for the SSO. What do you think the ultimate relationship will be between Surgical Oncology Insight and the journal that we've had for many, many years?
Yeah, the Annals of Surgical Oncology has been around for 30 years, as you know. But these two journals now are both the official journals of the SSO. And we're working very collaboratively and in harmony as sister journals. We've also instituted a manuscript cascading system that allows authors to submit their article to Surgical Oncology Insight in a seamless fashion with an expedited review if their article is not accepted to Annals of Surg-Onc, and it is recommended by the editorial staff of ASO to be transferred to Surgical Oncology Insight. And this process of cascading manuscripts has really greatly facilitated submissions to Surgical Oncology Insight as we launch a brand new journal off the ground.
Terrific. Thanks so much for explaining all these details to our membership of the SSO, and it's certainly going to be a great addition. And you've put an enormous amount of work in already just getting this off the ground, and I think it's going to yield a lot of benefits for the society and for cancer care and cancer education in the future. Thanks very much.
No, thank you very much for having me and giving me the opportunity to speak about Surg-Onc Insight. Appreciate it.